Welcome to our deep dive, examining the concerns regarding gene-based vaccines, as raised by Professor Ian Brighthope,
He's a prominent Australian physician and surgeon.
with 49 years of clinical practice.
We'll be focusing on his observations and concerns based on the information that he's presented.
Now, Professor Brighthope, he brings a unique perspective to this,
Not only from his extensive clinical practice,
but also from his background
as the founder of the Australian College of Nutrition and Environmental Medicine,
and his training in agricultural science also informs his perspective.
one of the primary concerns that Professor Brighthope has raised
Is the lack of comprehensive monitoring for cancer trends after the mass vaccination campaign in Australia.
over 60 million doses were administered to more than 20 million people
And he finds this lack of transparency,
from the Australian Department of Health concerns.
as it makes it very difficult to assess whether there have been any changes in cancer incidence following vaccination.
This raises the question of whether the current monitoring practices are sufficient to detect any potential long-term effects.
And adding to his concern,
Is the discovery of high levels of residual DNA contamination found in Australian vaccine vials,
and these levels exceed the permissible limits.
which raises questions about the manufacturing process and quality control measures for these vaccines,
Professor Brighthope is particularly alarmed by this contamination
because he believes it could potentially interact with the lipid nanoparticles.
that are used in some vaccines to deliver genetic material to various organs,
He suggests this combination could lead to genomic instability.
which is a condition where the DNA within cells becomes more prone to damage and mutations.
Professor Brighthope has observed in his clinical practice an increase in aggressive tumor growth and unusual cancer presentations,
This includes cases of multiple cancers in a single organ.
or two different types of cancer within the same organ,
And he believes this could potentially be linked to the genomic instability.
that he theorizes could be caused by DNA contamination and lipid nanoparticles.
This raises questions about whether there's a need for more research into the potential mechanisms by which vaccines could affect cellular processes and DNA integrity.
Another observation that Professor Brighthope has made in his practice is a rise in blood cancers.
Such as lymphomas and leukemias.
And he questions whether this increase could be linked to vaccination and argues for further investigation into this potential association. Professor Brighthope believes that the mRNA technology used in some of these vaccines wasn't adequately proven safe before widespread use, and he argues that the potential risks
Associated with this new technology,
may outweigh the perceived benefits and advocates for a more cautious approach.
this stance is rooted in his experience during the HIV/AIDS epidemic in the 1980s, where he faced scrutiny for advocating nutritional and alternative therapies alongside conventional medicine.
He draws parallels between the dismissal of alternative approaches then and the current situation with COVID-19.
He believes that a public health campaign promoting vitamin C and zinc could have significantly mitigated the impact of the COVID-19 pandemic.
He expresses frustration that these alternative approaches were not given more consideration by health authorities.
Professor Brighthope is a strong advocate for transparency from health authorities and the importance of informed consent, including the right to refuse medical treatment.
He believes individuals should have access to all necessary information to make informed decisions about their health.
This includes the right to decline any medical intervention, even if it's recommended by health authorities.
He believes that transparency from authorities is crucial to addressing public concerns and fostering trust in the healthcare system.
Professor Brighthope's observations and concerns about potential vaccine-related health issues stem from his clinical practice and his understanding of scientific literature.
He believes that these issues warrant further investigation and open discussion within the medical community and among public health officials.
He stresses the importance of acknowledging and investigating potential adverse effects, rather than dismissing them.
He advocates for a more cautious approach to vaccination with a focus on safety and informed consent.
He urges health authorities to implement robust monitoring of cancer trends following vaccination, develop testing protocols for individuals potentially exposed to synthetic DNA, and conduct thorough research into the prevention and treatment of vaccine-related conditions.
Professor Brighthope believes that a fundamental shift in perspective is needed, moving away from a reliance on pharmaceutical interventions and embracing a more holistic approach that acknowledges the interconnectedness of physical, mental, emotional, and environmental health. He envisions a future
where individuals are empowered to make informed decisions about their health and healthcare providers prioritize patient autonomy and well-being above all else. Professor Brighthope believes that a significant portion of the population
is seeking alternative perspectives and solutions when it comes to their health.
particularly in light of their experiences during the pandemic.
He argues that the current model of healthcare often falls short in addressing the root causes of illness.
He suggests a paradigm shift is necessary,
To create a truly healthy and resilient society
integrating conventional medicine,
with evidence-based.
complementary and alternative therapies could potentially create a more effective and compassionate healthcare system.
Professor Brighthope's message resonates with those seeking a more holistic approach to healthcare
Who value individual choice.
and informed consent in medical decision-making,
His insights challenge conventional thinking.
and encourage a critical examination of the dominant narratives surrounding health and wellness.
His perspective is particularly relevant
In the context of ongoing debates surrounding vaccine mandates,
in individual rights.
he emphasizes the importance of respecting individual autonomy and bodily integrity as fundamental principles.
That should not be compromised.
His call for transparency and accountability.
From health authorities and pharmaceutical companies resonates with those concerned about potential conflicts of interest.
And the suppression of dissenting voices.
Professor Brighthope's insights offer a valuable contribution to the ongoing discussion about the future of healthcare,
He reminds us that health is not merely the absence of disease.
but a state of complete physical.
Mental and social well-being
Achieving this,
requires a multifaceted approach.
that addresses the needs of the whole person.
His advocacy for informed consent and a more holistic approach to healthcare resonates with a growing number of individuals seeking greater autonomy and agency in their health journey.
His perspective encourages us to question the status quo
Seek out alternative perspectives.
and advocate for a healthcare system that prioritizes patient well-being and individual choice.
Professor Brighthope's insights provide a valuable framework for navigating the complex and ever-evolving landscape of health and wellness.
His message is a call to action for individuals
To take ownership of their health.
to seek out evidence-based information.
And to demand transparency and accountability from those in positions of authority.
He reminds us that true health is a collaborative endeavor,
Requiring open dialogue, mutual respect, and a commitment to finding solutions that benefit all.
Professor Brighthope's perspective offers a glimmer of hope in a world where fear, uncertainty, and doubt often dominate the narrative surrounding health and disease.
He reminds us that we have the power to make informed choices, advocate for our well-being, and create a future where health is not a privilege, but a right enjoyed by all.
So we've explored Professor Brighthope's concerns about potential long-term health effects of gene-based vaccines
Focusing on the lack of comprehensive monitoring for cancer trends.
and the presence of residual DNA contamination in vaccine vials.
We also discussed his belief in the importance of alternative therapies such as vitamin C and zinc,
His advocacy for transparency and informed consent.
and his call for a more holistic approach to healthcare.
Professor Brighthope's perspective encourages us to critically evaluate information from various sources and engage in thoughtful discussions about these complex issues. As we conclude this deep dive, we leave you with this question to consider: how can we as individuals and as a society ensure that healthcare decisions are made with transparency, accountability, and a commitment to prioritizing well-being for all?